Welcome to our introduction on compression, effleurage and petrissage. Compressions. Compression is a great technique. It warms up the tissues. We can use it to palpate the client, so to get a response from the tissue to see what's going on. It helps to relax the client, or equally it can invigorate the client depending on our speed. And it can be done through clothes, through towels, so it's great for pre-event work or at the start or the end of the session. But it can also be done directly on the skin, so it's a fantastic technique to be used throughout a massage session. But time and time again, I come back to it as a great before and a great tool for testing afterwards, because through your hands, your client will feel the difference in their own tissues. One thing to note when we're doing compression is it's not about compressing soft tissue into bone. Yes, it's about creating a compression within the soft tissue, but think about it as teasing tissue away from its attachments or away from the bones. So no compression directly into bones or joints. Now let's take a look at it in practice. In a lunge or a squat posture, nothing changes there. Here I'm just using my weight, rocking forwards and backwards in a squat position, and I'm sensing how the soft tissue on that back feels, but also how it moves, how the spine moves as I compress through that tissue. So my applicator here is simply the palm of a hand. Now moving into the glutes, I'm swapping to a nice soft elbow. I'm in a lunge, same principles of posture apply. So pushing by lifting that back heel, transferring weight onto the front foot. And I'm compressing and slowly releasing and sensing, does the tissue compress easily, more difficult? What is the client's tissues doing? So we're listening with our hands as well as making the tissues feel great. So here swapping to a soft fist and again palm of hand. So all of our applicators can do compression. We can use a squat or a lunge, but we need to ensure that we first connect with the client, and then when we want to compress, we're transferring weight either from the back of our heels to the front in a squat, as I'm doing here, or if we're in a lunge, from the back foot to the front foot as we lift the heel. Next up is effleurage. Effleurage comes from the French word effleur, which means to glide or touch lightly, and it's probably the most common massage technique that you come across or that people go to when they think of massage. We don't overuse it in sports massage, but we definitely use it in all our sessions as an introductory technique. It's smooth and it's gliding, and it helps to just calm things down, so it decreases that sympathetic nervous system activity. We often use it early on in the treatment to 1, apply lotion, 2, relax the client, and 3, as a palpation tool, so to find out where our client needs our deeper work. It also helps to introduce our touch to the therapist and gets that client to switch off and focus into their body. It can also help to warm up the tissue and increase local circulation, and it's a great technique to come back to throughout your treatment to connect the other techniques. So helps to bring flow and a nice fluidity to your treatment, and also again to palpate mid-treatment or after more specific, deeper techniques to see if you've achieved the result that you want. So let's have a look at how we do it. At its most simple, we can use hands as an applicator to spread the lotion. Again, posture never changes. We want to ensure that a line neutral spine, soft arm, soft applicator, and as we travel and transfer the weight, we're simply gliding through the tissues, listening to what's going on. We can have fast strokes, we can have slow strokes, and that's where we're looking at global and local work. So the slower we become, the deeper the stroke feels, and also the more specific we can get. So effleurage can go from quite a light, relaxing, spreading technique into quite a specific deep stroke and deep technique. So no matter which applicator we use, we want to ensure it's passive. So here, swapping to an assisted thumb, it's still effleurage, but now it's become slower, it's become more specific, and it's probably become a little deeper in terms of what that client feeds. So it's feeding back through my hands, and I can read where I need to slow down and where I need to do some more specific work and maybe swap to a different technique. Effleurage can be in any direction. So we started with nice longitudinal strokes along the spine, and now we're working transversely through those erector spinae again. So in a squat, transferring weight back to front of the legs. But again, this is still effleurage, although it looks quite different. It's more specific, and it's also working across the tissues. Here I'm pulling back through that quadratus lumborum, that gap between the ribs and the hip, and sitting back, transferring my weight, assisted fingers. This is a deep effleurage stroke. So again, becoming more specific and a little bit deeper than the strokes we started with. But this would still be classed as an effleurage. Swapping applicator again. Here I've chosen a soft supported fist. A lovely, slow, specific applicator to work through any part of the body. So here working through the back again, but this could be working through the legs, even across the front of the chest, or any part of the body where this applicator would be appropriate. In terms of direction, multi-directional. There was a time when we were taught that these strokes must be towards the heart, but the research has shown that we don't actually affect systematic circulation. Yes, there can be a local circulation impact, but not systemic. So in that case, we can work in any direction, longitudinal, away from the heart, transverse. It's all good stuff. It's more important that your strokes simply reflect your intention, lengthening, separating, creating space. You reflect your intention in the strokes that you choose. Here, dropping to a forearm, so again, my posture changes, my lunge gets wider so I can keep a nice aligned spine, but this is still a basic effleurage stroke. And finally, Petrissage. Again, comes from a French word, pétrir, which means to knead. Petrissage combines a variety of kneading techniques, so there's different ways of applying a petrissage stroke. It's often applied in shorter strokes of kneading, so we want to be pushing, grabbing, picking up tissue, separating tissue in a rhythmical motion. It can be quite a relaxing technique if we're nice and slow, but again it can be quite stimulating, so a really nice pre-event stroke or something to wake your client's tissues up at the end of a treatment by going faster through the tissues. Again, it has an impact on the lymphatic system because we're looking to create a pump effect with our hands. So quite often what I see in poorly executed petrissage is simply a vigorous effleurage where it's quite superficial, where what we want to achieve with our petrissage is a picking up, a kneading and a pumping of that tissue. So it's giving quite a different effect and feels quite different than effleurage itself. So let's have a quick look at an example of petrissage and you will be able to see what I mean about picking up tissue rather than gliding like we do in an effleurage stroke. So in a squat position here, as we're moving forwards and backwards, I'm transferring weight from one leg to the other, pushing tissue forward, pulling tissue back. Again, the hands are relaxed and passive. I don't want to see any straight fingers. Your fingers should be in contact with the tissue. That's a good sign of a relaxed applicator. And you can see that tissue between my hands. It's picking up, it's kneading. It's not a glide. It is a picking up of the tissue. So this one here, that forwards and backwards, is what we call ringing. We can apply that same technique up into the upper traps. We can do it on the legs, the calves, the quads, all around the body. So it's a really nice one where we've got thicker or bigger muscles that we can work through. Same action, it's coming from the hips, side to side, lovely neutral spine, lovely relaxed hands. The next one now, which is kneading, and this is more of a side to side action. It's a little bit more superficial. It's like creating an S shape with your hands. Again, looks quite similar there in the lower back, but it's actually a better technique on the thinner tissue. So around the rhomboids, the low to mid traps, as we move up the back, you can see how it's more superficial and it's more of a side to side action than a forward and back. So a subtle difference, but much better on the thinner, smaller muscle groups. And then we can always come back to our connecting strokes. So returning to an effleurage stroke and then clearing through the tissue. Same technique, different part of the body. So here working through the calves, again doing some wringing, that forward and backwards, picking up the tissue, wringing it out. And you can work the whole way up the leg, so into the hamstrings, into those lateral quads. And again, we could do this in supine, in sideline, wherever this applicator and this technique applies. As always, keep your thumb with your hand. We don't want to see the thumb coming away, picking up the tissue. Keep the thumb with the hand and focus on the palms of the hands, picking up the tissue. A really lovely technique that can be relaxing, palpatory, or even stimulating.